This program is brought to you by Parkway Cancer Center. Cancer usually strikes people aged 55 or older, and because of the skewed statistic, the disease is all too often misunderstood to be an older person's disease. It's a common perception among young people, inadvertently amounting to an act of denial, and that can have dangerous consequences. The truth is, while cancer is more common among older people, the disease will, from time to time, claim its share of young victims. And the ordeal they have to endure as cancer sufferers is by no means less traumatic. Think you're too young for cancer? Think again. Statistics have shown that the rates of some cancers, including colorectal, thyroid, and testicular cancers, are rising in people between the age of 20 and 39. A report released in August 2007 by Singapore's Cancer Registry found that while the cancer survival rate continues to improve in adults who are middle-aged and older, the corresponding rate for those aged 15 to 39 has barely risen for more than 2 decades. The hard facts show that one can never be too old or young to be hit by the deadly disease. Dr. Khoo Kay Seong, Deputy Medical Director and Senior Consultant at Parkway Cancer Center, sees about 20 to 30 new cancer patients every month. Of this number, about 3 are under the age of 30. When Dr. Khoo has to break the news of cancer to these young patients, they have a hard time coming to terms with the painful realization.
Well, this belief, of course, I know most people will think that one will only get cancer when they are older. So getting cancer at the age of 28, 26 is a real shock to them. Some of them are not able to fully comprehend. Many are still working, haven't even started their own family. So it's a big question mark as to what lies ahead of them, how to deal with the conditions, how they're going to go through it, whether they still have a future, whether they're going to be cured. So these are some of the reactions questions they always ask.
Like many other developing countries, Malaysia is facing a growing number of cancer cases among its populace. Almost 70,000 cancer cases were recorded between 2003 and 2005. That's according to the National Cancer Registry of Malaysia. Breast cancer had the highest occurrence and was the leading cause of cancer-related deaths among women. Grace lives with her parents in Johor Bahru. She was a cheerful girl who enjoyed a very active social life until her youthful exuberance was unexpectedly interrupted. Grace performed a self-examination on her breasts one night and discovered lumps. She immediately scheduled a biopsy the very next day. 2 weeks later, she was forced to confront the painful truth. Grace was diagnosed with stage 2 breast cancer. Tough news to digest, considering that Grace was only 29 then.
When doctors confirmed that what I have is cancer, I was very scared and a bit lost, don't know how I can overcome all the treatment. Surgery, I'm not really scared, but I heard a lot about chemo, and I heard that the pain is very horrible, and I really don't know how I can go through the treatment.
According to the World Health Organization, breast cancer is the most common cancer worldwide. Breast cancer makes up 16% of all cancers women suffer from. There are no clear indications suggesting the cause of breast cancer, but there are a number of risk factors. These include age, genetic predisposition, and even the consumption of birth control pills. But early detection often presents the greatest hope of discovery. Breast self-examinations and mammograms can help detect breast cancer at the early stages when it is most treatable.
Like for like, stage for stage, cancer that occurs in the younger age group tends to be more aggressive than the cancer that occurs in the older age group. So for a 20-something-year-old having the same cancer compared to someone in the 50s with exactly the same cancer, the younger age group had a higher risk of recurrence. What Grace has is also known as a triple negative cancer. Now we say triple negative because it is negative for estrogen receptor, it is negative for progesterone receptor, and is negative for HER2 receptor. We now recognize that triple negative tumor tends to have a more aggressive cause, as in they have a higher risk of recurrence.
After finding out that she had breast cancer, Grace had to contend with even more bad news. Grace was inflicted with a particular type of cancer that was not responsive to hormonal therapy. This particular type of cancer, common in hereditary breast cancers, tended to be more aggressive. Women aged 65 and older account for most of the new cases of breast cancer occurring in the world each year. And the number of older women with breast cancer is expected to double by 2030 as the baby boomers age. Grace, from Malaysia, however, embodies a harsh reminder that breast cancer can strike young women too. She was diagnosed with cancer at 29. But rather than wallow in self-pity, Grace chose to confront her illness head-on. She focused her attention not on her predicament, but on seeking a solution.
For me, is I don't ask why. There's no point to ask why as well, because asking why, that you won't find a solution, and also it won't help as well. The most important thing is we have to face it. How we're going to face it and then to overcome it.
No matter how difficult the treatment process was, Grace kept her confidence. And it was that confidence which seemed to galvanize her resolve.
I was actually quite surprised how calm she was when we got down to discussing the treatment programs, telling her that this is the treatment, you need chemotherapy and this will be the number of cycles you have to go through. Some of the side effects such as loss of hair, some nausea, some tiredness. She said, yep, I'm all ready, and just tell me when I should start. So she's mentally very prepared, knowing that this is something that's going to help her in the long run and face it squarely.
Over at another part of Malaysia, the idyllic seaside town of Malacca served as the setting for yet another story of another young person's struggle against cancer. Ever since she was a child, Eling led a very active lifestyle. By the time she hit her early teens, she had already become an accomplished sportswoman, representing her state in both swimming and taekwondo. At the age of 10, Eling was already winning medals at national youth tournaments.
I represented Malacca States when I was 15 years old and won 6 golds in my first competition.
As though her accomplishments in sport were not enough, Eling had a string of other interests and pursuits. She was especially passionate about music, playing not one, but 3 instruments: the piano, the violin, and the zither. Eling had what her parents would call a competitive streak. She pushed herself to her limits in almost everything she set her heart and mind to. In sports as well as music, Eling wanted to be the best she could possibly be. And she had a knack for excelling under pressure. Even in the face of mounting obstacles, Eling's ever-optimistic stride would remain unbroken.
I've never thought of giving up, even though training is very tiring, because I'm not the give-up type.
It was this true grit, honed so acutely in sport and music, that would serve Eling well, because what she had to confront next was to be the harshest challenge in her young life. Just months after her 10th birthday, Eling woke up one morning with an excruciating pain in her left knee. It was severely swollen. At first, her family dismissed it as a symptom of yet another of her very frequent sporting injuries. But after a week, the swelling refused to subside, and the pain was getting more intense. Eling finally paid a visit to her family doctor. An X-ray performed later at the hospital revealed she had osteogenic sarcoma, a form of malignant bone tumor. Among children and adolescents, half of osteogenic sarcoma arises from the bones around the knee. Amputation was undeniably the most obvious solution, but the prospect terrified Eling and her father Henry. The very thought of Eling having to give up her active lifestyle, which so defined her, was just too painful to accept. Without a fight, that is. Henry was desperate to explore all means to save Eling's leg and rid her of cancer at the same time. The family made their way to Singapore, hopeful of finding a solution from experts here. At the Gleneagles Hospital, they met orthopedic surgeon Dr. Liang and oncologist Khoo Kay Seong.
On that day itself, we decided to let Dr. Khoo to nurse my daughter. From there, he told me that we have to go for chemotherapy before any operation we have to do. From there, I think we have a few cycles of chemo. Then only we went for an operation to salvage her legs. So Dr. Liang is the orthopedic doctor. He successfully managed to salvage my daughter's left leg.
Because this tumor happens in younger age group, wherever possible, we would like to preserve the limb. Amputating a leg is easy, but amputating the leg will rob the person the chance to walk normally. They will need a prosthesis. No matter how good it is, it's never quite the same. So wherever possible, we will try to preserve the limb. And that sometimes requires the use of chemotherapy before surgery to shrink the tumor down and then to do a more limited resection. Selecting the right patient for limb preservation is very important. We need to work closely as a team with the orthopedic surgeon as well as the radiation oncologist so that maximize the chance of preserving the limb.
In an attempt to salvage Eling's leg, surgeons first removed fragments of her bone infected with cancerous cells. Later, they reinforced the bone tissue in her leg with metal plates and screws. The operation, a complicated one, was a success, and within weeks, Eling's leg was strong enough that she could start walking. Within months, her recovery was almost complete, and Eling was beginning to resume many of her sporting pursuits with her usual gusto. Sadly, the euphoria only lasted for 2 years. Cancer struck again, and this time it was more vicious than before. Grace was diagnosed with stage 2 breast cancer when she was only 29. She had always been a cheerful and optimistic person, but struck with cancer, Grace's exuberant disposition was replaced by despair. The disease dealt a crushing blow to the entire family.
My parents was very sad for me when I was diagnosed with cancer, and it was really a hard time for my family. And when I first day I went to Mount E, and there's a counselor and a volunteer to come with me and to follow me for the whole checkup. Cancer is treatable and there's hope. They encouraged me that I can live a normal life after the treatment. When I met my surgeon, he was very optimistic. He is very confident. He never gave me negative thoughts. He encouraged me to think positively throughout the treatment. So I was really glad to have treatment there and really glad to meet right people for me to encourage me for the treatment.
With the support of people around her, Grace soon found the strength she needed to overcome her fears. By the time chemotherapy began, Grace regained her resolve, determined to battle the disease with every ounce of optimism she could possibly muster.
She has never even hinted that this is too tough for her. Each time she comes, she was usual cheerful self. She did have side effects, which will take time to address them. I think the desire to do well and desire to beat the cancer is so strong that she was very, very determined to fight it.
Due to Grace's age and the aggressiveness of her cancer, Dr. Koo recommended 8 cycles of chemotherapy as a form of prevention against relapse. To help her cope, Dr. Koo prescribed certain drugs to counterattack any side effects that arose. Ultimately, Grace's best defense came from her positive mindset.
During the process, even though we feel like our body is not very comfortable, we can distract ourselves, like not to focus on our sickness, do something that we like watch TV, cleaning the house. Treatment is only temporarily, just focusing on we will have the victory at the end that waiting for us, and it's only a process. And we will fight the fight and then we will win it. So not to be scared and not to feel that there's no future, but there is hope.
Cross-stitching and planting cactus were some of the things that kept Grace going during those tough times.
I will go to garden to do exercise, and doctors say exercise can help to recover faster and also to build our immune system. Just do something that I want, I like to do. Sometimes we'll prepare a bit of food.
Meanwhile, elsewhere in Malaysia, another young person confronted cancer once again. Eling, who underwent a successful limb-saving surgery previously in a battle against osteogenic sarcoma, now had new cancer cells spreading through her body.
After 2 years, Eling have a recurrent cancer. So this cancer spread on Eling lungs. So both of the lungs got nodules. So on the right lungs, Eling have the fluid go through Eling lungs, and the nodules also burst. So we decided to go immediate to Singapore, and finally, after the CT scan showed that it's confirmed that the fluids already go into the lungs.
Eling responded well to the chemotherapy administered to her. She went under the surgical knife once again to remove the remaining tumor in her lungs. After a lung operation, Eling's ordeal was far from over. An excruciating pain in Eling's left leg led to the discovery that the metal plate inserted during surgery 2 years ago was now broken and the bone graft was not healing well. Eling was actually struggling with a non-functioning leg, which was also causing her unbearable pain. In that regard, her doctors had to give the recommendation of amputation with the rationale that she would have more mobility and a much better quality of life without her leg rather than with it.
I was surprised to find that she is a very matured person, and also when we have the discussion on this amputation, we want her to decide whether to amputate or not to amputate. So finally, she gave us the answer saying that she wants to be amputated. I think part of it is she already carried her legs for 2 years, and it seems like there is no any good function for her with the salvage legs because her legs is bending and she cannot use at all.
With their whole lives ahead of them, young cancer survivors often have much uncertainty to contend with, despite beating cancer. Their concerns are very real, from relapses to reintegration into society. Some even cringe at the thought of talking about their condition among colleagues and people around them. In the case of Eling and Grace, cancer had dealt especially harsh blows. The disease had cheated them of their youth and health, even claiming important parts of their bodies in the process. The first step of treatment for Grace was a mastectomy. In brutal layman's terms, that's a complete removal of the affected breast. The procedure involves an incision in the affected area of the breast. This incision is then deepened, followed by separation of the breast tissue from the muscle beneath it. After the breast tissue is removed completely, drainage tubes are inserted to remove excess blood and fluids before closing up the operated site with sutures. This complete removal of the affected breast tissue, along with the underarm lymph nodes, is performed to stop the spread of cancerous cells to the rest of the body. While many women would immediately crumble at the prospect, equating it to be a removal of their womanhood, Grace never once flinched. And if not for the advice of a Parkway Cancer Center counselor, Grace would have even foregone a breast reconstruction surgery.
When doctor told me that I have to remove my whole breast, I think that it is necessary, and the faster it removed, the better the chances of survival.
As for Eling, who is now 16 years old, her cancer is in remission, and she goes for treatment every 3 months. And she's been living with just one leg for the past 4 years. Despite being handicapped, her talent in music and sports has continued to attract the attention of the media. She's become a celebrity of sorts and an inspiration among young cancer sufferers in her country.
She has her ups and downs. She's fearful of needle prickings, but we managed to create something that make it less painful for her. And she went through a treatment, I must say. I'm quite proud that she was able to go through it without much hassle.
Eling is realistic about the challenges she has to overcome living with her disability. Yet, she remains as optimistic and determined as ever. Her commitment to her many passions has never let up, because Eling, as many close to her will attest, loves a challenge, and she's never afraid of dreaming big. Eling now plans to read law in London, and it's probably certain that she would quite easily lick that challenge too, just as she has done with the many conquests she has made in her young life. It's a confidence that springs from that remarkable strength of character she's shown in facing up to some of life's not so little challenges.
Because I'm just like any other normal people, so I can do everything they can do or even more. If I can do it, you can do it.
A cancer diagnosis, among many who have the misfortune of being inflicted by this dreaded disease, is often too quickly deemed a death sentence, a cruel, abrupt termination of one's future, an end. But as the stories of these survivors show, cancer should instead be thought of as a battle, not a declaration of defeat. Medical technologies have vastly improved a cancer victim's chances of survival. Yet, these weapons pack the most punch when accompanied by a patient's courage and hope. A cancer diagnosis must not be thought to be an end, but as a beginning. This program was brought to you by Parkway Cancer Center.